Hey, good afternoon, everybody. This is your County Executive Ed Day. I want to thank you for joining me this afternoon. We're going to jump right into the questions today, and I'm going to be turning this over to our Director of Communications, John Lyon, who has been fielding your questions online. John?
Okay, thanks everyone who wrote in either through direct message or in the comments section today. The first question, where can I see the daily positive case numbers and the transmission rates? Really what's going on here in Rockland related to COVID.
Well, one thing I want to mention, there is a website called rt.live, rt.live. It gives you infection rates for the whole nation with all this back and forth about what states you should go to, shouldn't go to. You'll find it very intriguing to take a look at that. So keep that in mind also. You can visit our website, rocklandgov.com, and click on the link that is to the dashboards we have there. The dashboard lists cases by town, municipality, zip code to see exactly where new cases are located, and you would need to compare these numbers day to day in order to get that information. Internally, our health department has been working with our planning department quite well. It's a partnership between them, and they've been able to map out these new cases to watch for any possible clusters or spikes. Now, there's been some conversation about today. Our number was at 4.2%. Which is relatively, it's a little higher than what we're used to seeing, but it's important to understand that there are specific reasons why this came this way. One of them is the number of tests that are made. We're not comfortable with the way these numbers are coming into us because it seems somewhat illogical to have a low number of tests one day and a very high number the next day. So we look at that. We did have two situations that we identified, an EMT class that was held. There was one case there, and there was 45 contacts. Now, what that means is that 45 people had some degree of exposure, and this is where the contact tracing comes in handy. We had a yeshiva, a 13-year-old young boy, had one case with 15 contacts. So, they're rolling. Those numbers are being tracked right now, and that will continue as we do normally with contact tracing. But again, it's a 7-day rolling average that really tells the tale as to exactly what's going on. But what it does also, it reminds us that every new case comes with it something called using vigilance. We have to be careful. We have to learn to live with this disease. I've mentioned this more than once. We need to continue to take common sense precautions that typically are good things to do just to keep yourself healthy from any virus. These precautions have helped us get to where we were. Remember, we were one of the worst counties that were hit, and today we're doing quite well. So just please keep it up and maintain social distancing when you can. If you cannot, remain 6 feet away from other people. Wear a face covering and wash your hands. Wash your hands. Don't touch your face, your eyes in particular. That's one way of spreading a germ coming off your hands. These habits seemingly have been effective. And we really should stay with them right now to keep our community safe and keep us heading in the right direction so we come up with a full reopening of our county at some point in the near term.
Okay. The next question that came in, what is the plan now that cases are beginning to rise here in Rockland County? This person wrote that it was at an alarming rate.
Right.
I do not personally believe it's an alarming rate, but any rise in cases should be a concern to people.
Yes.
So what's being done here?
Well, one thing I will say, I will echo what John just said, this is not an alarming rate. This is part of a testing process. New York State is ahead of everybody in testing. It's identifying cases. It is not cause for alarm, number one. As I said earlier, a little while ago, when we see an uptick in numbers, we react immediately to it. So that's what we're doing. The acceptable metrics have always been accepted as a rolling 7-day average. If you look at those metrics, those reports, you'll see that we have been on 1%, a little over 1%. When they were 2%, this 4% number was a higher number. But again, when you end up with one person sick in a large classroom, for example, that's going to increase the numbers. And again, as I said before, our health department and our planning department working very closely to identify, track, and interrupt the disease continuation. And that's been the plan all along. The reopening process has been to treat these reopenings like a valve. As long as things are going well, we would open it up a little bit, and if things we start seeing some issues, we'd slowly close the valve down. We have had very little of that, frankly, because we've been pretty steady. To my point, the 7-day rolling average, we've been pretty steady in this area. We haven't had to make any sudden moves to change things. But we'll continue to keep an eye on the new cases as they come in, and through our contact tracing program, identify the places where transmissions are happening. If it begins to happen in specific places, we will inform the state and make the changes necessary to prevent the exponential spread of this disease. We have learned how to slow the spread down, as I mentioned earlier. Those habits of washing your hands, social distancing, and face coverings seem to have brought us to this point. So we really should continue with what seemingly has been working. And to be clear, there have not been any recent clusters of public concern related to these cases, and thankfully, very few people are hospitalized. This shows that we are not in the same type of crisis that we were earlier this year, where hundreds of people were hospitalized.
Okay. And this next question sort of touches on something you just mentioned. What could possibly change our reopening?
Okay.
This person wrote in, they remember that there were certain percentages for a certain number of days in a row that had to be met. Can you go through what those criteria are and how people can see them? I'm
going to go over them, but the information is on our rocklandgov.com website, so I'm going to give you some sense of what is being looked at as it relates to metrics on a regional basis, by the way. This is the Mid-Hudson region. There were 7 different criteria that were originally required to move forward through the reopening phases. We have spoken about them in the past. Basically, a sustained hospitalization decline or daily net increase in hospitalizations. That's something that would garner attention. A decline in hospital deaths based on a 3-day average. As said, you can't take raw information and just read much into it on one day. You have to have an average over a period of time. New hospitalizations are very important. It tells us that a case is somebody testing positive. That person could be asymptomatic. That person may have a cold symptoms, and that's it. So again, obviously beyond the fact that person should not interact with other people and spread the disease further, that is not something that's going to cause great medical concern and see us go through what we went through before with the hospitalizations. Available beds in the hospitals. The hospitals have plenty of room right now, so that's a positive thing. ICU beds, again, 30% threshold of open beds has been easily met. Diagnostic testing capability. We've been conducting, on average, close to about 1,000 people a day, I guess, or per month rather, and the tracing of at least 30 contact traces per 100,000 residents. So you can see all this information, the very specific information, at rocklandgov.com, and clicking on our metric dashboard to give you some senses. But what I will tell you is this: right now our numbers are good. We are well in line where we need to be to keep moving forward. So don't react to the one day, one number scenario. And one thing I do want you to know is that we've spent a lot of time and effort getting us to where we are right now in a very strategic manner, and we're going to continue to do that. It makes no sense for us here to take it easy. It makes no sense for us to treat it like it's no big deal. But I want you to put it into perspective. That's very important for your own health, frankly.
Absolutely. So one other question that came in related to COVID. This person wrote in, the president of their condo board has posted a notice on everyone's door which states that masks are required as soon as you walk out the door of your condo until you get into your car, and the reverse.
Right.
They now also want to have the board vote on fining people who don't follow these rules. What can you tell us about that? Is that allowed? Where does that fall?
Well, that you're not going to find on the forward.ny.gov website. That's not something that you're going to find the state is accounting and saying. However, that said, you have to check your own specific condo association rules and see if the issuance of fines is allowed or not. I don't know. I can't answer that question. In the complex I live in, a very similar rule has been established. When we walk out of our apartment, we're supposed to have face covering on, no matter where we are, even outdoors. Now, again, when I go outside to walk, I will have my mask down and I'll walk because, frankly, breathing your own carbon dioxide is not a healthy thing. But I put it back up if somebody's walking towards you, which is exactly what you're supposed to do. So check with your condo board or HOA, find out exactly what's going on, go to the meetings, involve yourself, and find like-minded people who may feel the same way. It's probably the best thing you can do.
And the last question that came in is not necessarily, well, it's tangentially connected to COVID-19. What happened last week with the county legislature during their meeting, and why didn't they do anything on the
Right.
resolutions you submitted?
Well, you could say it's tangentially related to this because we're in a COVID-driven financial crisis right now. Sometimes you just really just sit back and shake your head. You know, it was pretty much common knowledge here in government. And I wouldn't expect the average person to know about this, but there has been a budding crisis, which I did speak about some 6+ months ago, that what's going on now is a loss of revenue, sales tax revenue, because of closings of businesses. And now coupled with the fact that the state of New York is cutting back reimbursements on programs they're supposed to be paying for, and we manage, and they're mandated, so we have no choice but to continue them. But what happened is we saw the downward trends, and we kept a good eye on it, and then in mid-July, we came to critical mass. Our sales tax receipts dropped like a stone. We're looking at a 50% drop in July. That's a significant amount of money. And we're looking at a $40 to $50 million shortfall for 2020 alone. Now, we have independent information. We just don't go by what we think. We go by other information. The New York State Association of Counties, NYSAC, a well-regarded organization that's statewide involved in government policies here in New York State, they were projecting a COVID-driven shortfall of a low of $58 million to a high of $108 million for 2020 and 2021 combined. Now, clearly we had a crisis identified. At this point, when I saw the last numbers that came in back in July, at that moment in time, with that snapshot we had and the potential horrible projections we were looking at, I reached out to the legislative leadership, requested a meeting with them, and we did that. I did a briefing with them on August 4th. Now, some have heard this is about a sales tax increase. This was a financial plan that I laid out for the legislature on August 4th. We used the independent projections to design to address the temporary yet what I call the powerful fiscal tsunami. We laid out what we had done since mid-March to reduce expenditures. We wanted an austerity budget. We included that we instituted a hiring freeze, getting FEMA's list for reimbursement for the expenses that were COVID-related. Elimination of all non-essential purchasing was put into play. We looked at, while we just didn't look at one side of the ledger, we looked at, is there any money that we're not spending because of the COVID crisis? And we found millions of dollars that had not been spent because we had not been out doing many of the programs that we've been doing before. We're able to claw back $18 million from unexpended monies to put up in a protection against what was happening here. We looked at positions that were not necessary. We worked with our department managers and our commissioners. We found a number of job positions, and we saved nearly another $1 million. So, we cut back or saved nearly $20 million. And in all honesty, it would be an absolute utter fantasy to think that any organization could take a hit of $40 to $50 million, and in this case, sales tax revenue, and an $8 to $20 million hit from the state government for their mandated programs and do nothing. It's just not reality. There are costs that are incurred just in running your government and doing all the things that we do for the people of Rockland County. We also looked at our workforce. Our workforce has 22% lighter now than it was when I came into office. We've trimmed about 470 jobs from our workforce. So we've taken a number of actions here to do this, but we still were left with a $20 million projected shortfall going to 2021, and we have a budget to prepare by October 1st. So $20 million, the equivalent of about a 15% county property tax increase, is about the equivalent of 200 layoffs of county workers, or the temporary institution of a 0.5%, what I call a COVID sales tax. I felt this was a solution that was temporarily driven by expiring sales tax, which would be spread over more people to keep the burden off the backs of our already overly burdened homeowners. And the small business owners also, who again don't need an increase in property tax. It's also would also generate revenue from people who live outside the county, again taking the burden solely off the local taxpayer and residents. For example, The estimated 76% of the shoppers who go to the Palisades Center are from out of the county. They're spending their money there. That money generates sales tax revenue, and it helps fund expenses here in Rockland County. So this small increase, and just to put in perspective, what this increase would be, for a $10 purchase, it would add a nickel. And it would be temporary, and it was written into the resolution that it would expire in a couple of 2 or 3 years, depending when it started. And it would last only as long as we projected the COVID impact to last. We provided supporting independent documentation with the legislative leadership, and we asked them that this is critically time sensitive. If there's any doubt or any questions, simply call us. I spent some time in the legislative chambers briefing all my colleagues in government. We told them that timeliness was critical because this would be about a 3-month process. So in order for us to legitimately put it in the budget, we need to have some semblance of certainty that it would pass in Albany, because it has to go to our state representatives. It has to get a number, that has to come back, get revoted again, and then also would end up being voted on by the legislators in the Assembly and the Senate and signed by the governor. I spoke to all 6 of our local state representatives. They all expressed support for what we're trying to get done. They understood it. The bottom line was that if the legislature had voted for this at that meeting on September 1st, 1 month later, we'll be able to start a process that we may, if we see conditions change, alter. But we have to have that process started because it's a 3-month process. I made it very clear that for this to be the 2021 budget, it would have to be approved at the September 1st meeting, and also it would not be finalized till the end of the process. So if we saw conditions change, we will be if they got better, we could stop moving on the item. But we have to be at the ready, because the way conditions are right now, they were not improving. So we want to be prepared. Now, with all that work that was done, you could imagine my chagrin when the vote came in defeating the proposal along party lines, and it was accompanied by repeated claims from the Democratic majority that we need more information. Again, every bit of information available to me was given to them. We asked them repeatedly, if you have any questions over the next month, let us know. We'll be happy to sit down and go over with you. 1 month of rumination, 1 month in the middle of a crisis. Not a phone call, not a question, not a request for a meeting, not an email from any of these legislators. 1 month apparently not even looking at the information that we supplied, nor any other information that'd be available independently. They have every opportunity to go to NISAC and look at their website and get the information that I'm looking at. We supplied the information to them. On top of that, my favorite topic, the Sane building. It sits across the street. It is an eyesore here in New City. We asked them to surplus that property, signal to potential buyers that they're serious about selling the property. We lost $4.5 million already on that property back in 2015. We are losing $500,000 a year $500,000 a year in property taxes that goes to our schools, our towns, and our county. The reason the chairman stated he did not want to rush to judgment. Now, bear in mind, the proposal was submitted by resolution October 1st, 2015. I don't know, we're talking about turtles or people at this point. 5 years, rush to judgment, and on top of that, the other legislative chairman, Legislator Earl, when he had tenure for a couple of years, in January 2019, he said it's a top priority. Now, I would like to believe that you out there function like I do in many ways. When you see something, you get it done. You don't ruminate to the point of ad nauseum. This is just ridiculous. There's no other way of putting it. My door remains open. I don't have much more time, frankly, and I told the legislators after the vote. But I've yet to hear any realistic alternatives. What I heard on the Zoom meeting that they're doing right now for legislative meetings, I heard Legislative Earl say cut overtime. I mean, seriously, that is what he thinks we haven't done yet. Legislative Wolf, he said we should focus on economic development. We have brought in over $8 billion of rateable. We have been probably more successful than any county in the state of New York in bringing in economic development. It's been a hallmark of this administration. For him to say we should focus on it is laughable. What is it? Has he been reading anything? And then the best one, and you'll all love this, Itamar Yeager, Legislator Yeager, represents Montebello, I think Montebello and New Square. He raised the specter of ready for this? A Rockland County income tax. How's that sound? I thought you'd love that one too. Obviously, the first two are comical. They're not even worth responding to beyond here. The last one was just absolutely ridiculous. But these are absurd responses, and they're reflective of the disinterest that the 9 Democratic majority legislators who, during this crisis, have never even picked up a phone for an update on, or even offer any input on this crisis that started over 6 months ago. They're elected officials too. My administration, everybody here has worked very hard over the past number of months trying to get everything done that is commensurate with the crisis we're in. I also want to say I give plaudits to our minority legislators. They have the legislative minority, Lon Hofstein, Vince Ty, their deputy, have routinely contacted me, asked me for information. They've been staying up on top of everything, but they've been abreast of the issues, and I want to acknowledge them publicly because they supported this financial plan. So why did they not bring these and their other ideas forward over the past month? The last thing, when I tell you it's critical time-wise, you don't have the time to wait to see what the federal government's going to do in this back and forth that's going between Washington, D.C. and Albany. We have a budget to prepare, and they know full well. So I look at this as nothing but petty partisan politics, and frankly, I would like to think, and I said this, that this is a balanced and temporary solution to a crisis that's not going to be permanent. It made no sense to raise your property taxes over something that's going to go away, and a sunsetted provision in the sales tax I felt made a lot of good sense. And again, like I said, $20 million in revenue. It's either that sales tax increase that will expire, very small, a nickel on every $10 you spend, 15% roughly county property tax increase, or layoffs. It really unnecessary pain that really is not. We should not be dealing with. Finally, to do nothing, as happened in the 2008 recession. I do remember that. The previous administration really did not do anything to protect itself against that recession at that time. It would again lead to what we fixed over the past 6 years. We had massive deficits. We ended up with double-digit property tax increases. We had no money in the bank, and we would see the collapse of our now excellent A1 bond rating. These are what I call the sins of the past, and here we are again in a very similar situation. And in closing, it's good for you to know that the 9 current legislators who were there, 5 of them were there in 2008, and they also this time voted this down. I guess they haven't learned from the last experience that the time for action comes, and it means times for decision have to be made. Legislators Wolf, Soskin, Cornell, Grant, and Hood, 5 legislators who served back in 2008, voted this down. And also I want to mention Legislator Soskin. They opened the meetings up with prayers and comments from legislators. Phil, nice gentleman, offered up some platitudes for our county work, our frontline workers, those who've been delivering services during the worst of times. And I think we can all maybe take a step back and acknowledge that. He makes a vote that may cost them their job, put their jobs in peril. Think about that. This is a total disconnect, and I don't understand it. I really don't, for the life of me. But we need to have action here, and I'll take every step I have to take. But if there's any pain, because this should have been a 0% property tax increase year for 2021, everything was working out fine. Our economy was going great. We have a chance now to do the right thing. What I said, I'll close with this. When I spoke to the legislative leadership, I said to them, this is an opportunity where Democrats and Republicans in the legislature can come together, cross-party lines, with one goal of the common good. And then the legislature can work hand in glove with the executive branch to do what the people of Rockland expect to be done by their elected leaders. Do the right thing. Manage crisis. Get things done. That's what you expect of all of us. You expect it of me, and I certainly welcome that expectation. But to see what happened here with a massive, a detailed financial plan being laid out, and knowing full well that the crisis is upon us, to punt which is what you saw here today, to want to wait to see what happens in Washington, yeah, we'll go with that. That's absolutely absurd. And at the end of the day, the true victims will be the people of Rockland County. I will do everything in my power to make sure that that pain is minimal, but if there's any pain in this budget, there should have been number one, but if there is now, you can thank 9 legislators in the majority of Rockland County for that pain, because it's all unnecessary and unneeded. So you may sense that I get a little worked up over this. I do take this personal, frankly, I do. I take my service to you to heart, always have, and I will continue to do so. So, again, I'm okay, but not very happy, and I'm sure you're probably not happy either. I would suggest 638-5100, 638-5100. If you're as angry as I'm about this, pick up the phone, call the legislative office, and tell them to get off their you-know-what and get this done. Come back in the session. They've only been meeting once a month. Come back in the session, call an emergency meeting, vote on this now before it's too late, and I have to take other options. I have to make other options, put other options in play, because I have only until October 1st to do this budget. That's only about 3 weeks away. Finally, if you have any problems with what you're seeing as far as it relates to abiding by the rules, the New York State Pause Hotline at 833-789-0470, 833-789-0470. The websites for the opening of the various phases, forward.ny.gov, forward.ny.gov. Our website is rocklandgov.com, rocklandgov.com. And finally, emergency orders that the governor's put out, New York State website, ny.gov, ny.gov. So with that, I will bid you a good afternoon. We will be back on the air next week, same time, Tuesday, 4:15. And until then, have a wonderful evening. Bye-bye.